COVID didn't cause all these issues. It peeled back the layers to show what was actually happening.
Hannah Drummond is an emergency room nurse in North Carolina.
The pandemic exposed that a business model doesn't work when it comes to healthcare, because each individual human being has infinite variables and has dignity that exists far beyond something coming off the factory line.
Hospitals are still understaffed, according to Drummond.
Nobody's coming to save us. We have to save ourselves. They've cut down on the number of techs that we have, and we often don't have housekeeping anymore. I'm literally drawing all my own blood. I'm doing my own transporting. I'm taking my patients to the bathroom. I'm cleaning them up, as well as all my duties as their nurse. And some days I am taking on more patients than I'm supposed to. And the hospital just seems to be using, this crisis since COVID started of not having enough nurses. But it's you are cutting things left and right. So what's the crisis? Is it the lack of bodies, or is it your inability to prioritize safety? The hospitals are touting this rhetoric, and even the government touting this rhetoric of oh, there's a nursing shortage. There's no shortage. There are 4 million nurses across the country who have active licenses that are no longer working as registered nurses because they're tired of working in horrendous working conditions that are unsafe, where they can't give their patients the quality of care that they know their patients deserve. You can only sustain that for so long.
It's unconscionable that all of the healthcare industry made billions of dollars in profit during the pandemic, while people were struggling just to get basic access to healthcare like vaccines and mild treatments.
Deborah Berger is co-president of National Nurses United, the union that Drummond is part of. She says healthcare workers across the U.S. are feeling similar frustrations with the healthcare system.
They've been put in such a difficult position. Even before the pandemic, we were suffering from many of the hospital policies designed to increase their profits, which means that they staffed just in time. They had just in time supplies. When we had the heads up from what was happening in China, we realized it was going to be really difficult to provide care with the industry model at the time. And the industry ignored us. The government at the time ignored us. So we were left to fend for ourselves. And you saw what happened. Everybody saw what happened, which was nurses were using garbage can bags. They were making do with masks for weeks at a time. COVID has, yes, it has decreased the cases, but because the industry is still following that staffing model of just in time, they've cut staffing at a time when they should be keeping similar staffing levels, because the patients that we still have in the hospitals are critically ill.
Berger points out that healthcare worker burnout gets a lot of attention, but the industry's shortcomings are the root of the issue.
We often refer to it as moral distress and moral injury. It's not really burnout. It's the actual moral injury that nurses and healthcare workers are feeling because they know that they're not able to do the job they need to do. And no amount of self-care is actually going to help with that, because it's a situation, it's not the nurse or the healthcare worker's fault, it's the fault of the industry.
Both Drummond and Berger agree that the focus needs to be on patient care and providing healthcare workers with the necessary resources.
They need to listen to us. They need to invest their money and their resources into giving us what we need to take care of patients. We don't want to be heard. We want to see action. We want to see literal changes happen.
I know that nurses would come back if they knew that they were supported, that they were valued, and that they could give the care that they know they can give. And we still have to hold the employers accountable for the lack of resources, the lack of support.